All right, thank you very much. Sorry for the inconvenience, please. Now we have Dr. Akofa Lassie, specialist ophthalmologist, is going to share with us on red eye. Please, Dr. Akofa, over to you.
Okay, sorry about the initial challenge, but now I hope I'm very clearly heard.
Yes, very clear. Thank you.
Okay, so like I was saying, this afternoon we are discussing red eye, and we'll go by this outline where we would ask what a red eye is. We would look briefly at parts of the eye, who is at risk, causes of this problem, and then we'll discuss patterns of redness, what to do when you have a red eye, when to be worried, and then we'll wrap it up with our take-home message. So for starters, when we ask what is red eye, this is a very common cartoon character for those of you who are interested in cartoons. Typically, whenever he's on screen, his eyes are red. And so when we say you have a red eye, it means that you have engorged conjunctival vessels. There are some blood vessels that supply the eye. And when those vessels become big or excessively filled with blood, that's when we call them engorged. And so it shows on the eye as red. Or when you have actually a bleed on the surface of the eye, that is what we call a hemorrhage on the surface of the eye. It can also give you a red eye. But I must add that a very common thing, which most people take for granted, even lack of sleep overnight, when you wake up in the morning, you can have a red eye. So a red eye can be acute or chronic. And we'll look at some of those things in a little more detail later. So I'll try very hard not to bore you with too much anatomy, but I'm sure this slide over here gives you some deja vu moments of that boring biology class when you were in junior high school or senior high school doing core science. But unfortunately, we'll have to go through some parts of the eye. So we have this. This is what you see when you take a cross-section through the eye. I'll go through it very quickly, not to bore you. So per the arrow shown on the screen, the white portion, the anterior portion, that clear portion is the cornea. Then after that, we have the anterior chamber. Then we have this whitish crystalline structure here, as seen per the arrow, that's the lens. And then beyond that is the back of the eye. For those of you who would remember some of your science, you would remember what we used to call aqueous humor and vitreous humor. It is in these parts of the eye that you would find it. And when there is any problem with any of these structures, you can get a red eye. So who is at risk of getting a red eye? That question is very simple. All of us. Anybody can get a red eye, right from a newborn baby to a growing child, through your teenage years, through your working life, into your adulthood. Anybody can get a red eye. So we jump into the causes of red eye. So like I said earlier, the causes range from anything that affects all the structural layers of the eye. So right from the cornea to the conjunctiva, to the sclera, to the iris and ciliary body, the anterior chamber, the eyelid, and then the orbit. So we will take these in a bit more detail. So when we are talking about causes, like I said, we group them into eyelid related. So when we talk about your eyelid, the eyelid is what opens and shuts so that your eye at every point in time is either opened or closed. That structure that does that open and closing maneuver is what is called the eyelid. So normally the eyelid has a line of hair, which everybody normally has. That line of hair points outward and upward so that it does not touch directly on the surface on the eye. But in cases where there's an anomaly, okay, as illustrated in the top left photograph on the screen, the eyelashes normally should point upward and outward. But you can have instances where the eyelash will point downward and inward. Once you have that, the eyes can become red because the lashes will be rubbing on the surface of the eye and cause a lot of discomfort. Well, doctors will call that pathology trichiasis. Okay, Then when we look at the down left photograph, you also have eyelashes rubbing on the eye surface. But in this photograph, you see that the lashes normally are supposed to come from this line we call the lash line. But in some cases, some people do not have the lashes going from there. They have it going from an anomalous place. And that pathology is also called a distichiasis. So that one can also make the eye red. And then normally the lashes open and close and shut in a very unique fashion, just so that the tears on the eye will rub fully on the eye surface. But in some cases, as shown in the right photograph A, you would have the lashes turning, the eyelid turning inward. That can also give redness. And when the eyelash also turns outward, it can also cause the eyes to become red. So any problem with your eyelid, be it the position of the lashes, that is the hair on the eyelid, or the position of the lid, that means the lid is turning inward and outward and causing rubbing on the eye surface, can give you a red eye. Then there is more. So you'll find that some people, when they sleep, their eyes don't close very well. That is normal for some people, but other people, it can actually be a problem where the lids do not close very well. Once the lid does not close very well, it means that the tears are not spreading well on the eye. And once the tears don't spread well, the eyes have a tendency of becoming red. So as shown here, this gentleman, once he closes his eyes, they don't close well. So once he opens them, the inferior portion of the eye will be red. We call that a lag of thalamus. And then when you have an actual inflammation at the eyelid margin, as illustrated here, where there's a lot of scales and debris on the eyelid where the lashes are, such that the flow of tears over the eye surface is not good enough, the eyes will become red. And that one, we call it a blepharitis or a mebomitis. It can make the eyes red. Then the inferior photograph here, this swelling, there's this round swelling here. When you have a swelling here, it means that the drainage of the tears, everybody, when you depress your eyelid, you see that in the corner close to the nose, there's a certain small hole there that allows the tears to drain. But in some individuals, there can be anomalies with it, such that the drainage of the tears is poor. When the drainage is poor, there can be collection in this position as illustrated. And that one, we call it a dacryocystitis. So once you have it going on for a long time, it can also make the eye red. Then when the punctum, or where the tears pass, there's infection at that place, as is shown here, with these large yellowish crystals called the canaliculitis. It can also make your eyes red. Okay, and the next structure is the conjunctiva. The conjunctiva is that white, thin, paper-like, clear film-like structure on the eye surface. Everybody has it. It's thin. We can liken it to cling film. For those of you who are familiar with wrappings of pastries, you know that thin, clear, transparent material that is used to wrap it so that you can see the beauty of whatever pastry you intend to buy. On the eye surface, it can be likened to the conjunctiva. It's clear, but then again, there can be problems with it. So like I said, red eye can occur all the way from when you are a baby, growing up into your adult ages. So here we have a baby crying. So newborn babies get what we call ophthalmia neonatorum. So where there's a lot of redness and discharge on the eye surface when they are born. Commonly from infections they pick up from the mother's birth canal during delivery. It will give newborn babies red eye. Then there can also be a bleed, an actual bleed on the eye surface, as shown in all this redness we are getting inferiorly here. So this actual bleed commonly can occur from trauma. So if you have somebody maybe was engaged in a fight, and then after the fight, you see that the eye looks red, this is the pattern of redness you can get. It's called a subconjunctival hemorrhage. It's actually a bleed. Basically, it's a bleed into the conjunctival structure, which I've described. And we can also have, so those are the traumatic ones. Then you can also get spontaneous bleeds or atraumatic ones, where people with bleeding problems, bleeding diastasis, anything with clotting, their blood is not clotting well. They can also, after excessively rubbing the eye, so some people they say they rub their eye vigorously. Then they look in a mirror. Sometimes they are not even aware. Then they realize that, my eye looks red. They most likely may have induced what we call a subconjunctival hemorrhage. Then the next photograph here is showing you a healthy eye, and then when the eye gets infected. So a healthy eye here, the eyelashes are nice up and out. The conjunctiva, this white structure here, is clear. Then when you have an infection from bacteria, you can have redness as shown here. But this redness comes with a lot of discharge at the lid margin. So somebody comes, the eye is red, and you ask and you see, in the morning there's a lot of discharge on my eye. I have to be wiping a lot of discharge on the eye. Think about bacterial conjunctivitis. Then the eye can also be red, but this time there'll be clear discharge from the eye, watery discharge from the eye. That is indicative of a viral conjunctivitis. Then there can also be redness, but the discharge will be stringy. Stringy is also, it looks like I'm pulling out a string from my eye. Those are the allergic people. So that is also red eye, but it is from allergic conjunctivitis. Then this is further illustrating the point I just described. So conjunctivitis basically means that thin film lying on the eye surface is reddened or inflamed. But bear in mind that there are different types that can occur. We have allergic, we have viral, and bacterial. The differences are in allergic, there's some eye rubbing together with redness of the eye. And then they tend to have very stringy discharge. Viral, there's redness, but they have clear discharge. Bacterial, they have a lot of mucoid, thick yellowish mucoid discharge from the eye with redness. Then further, when we are discussing conjunctivitis, there are several other things that can make the eye red at the level of the conjunctiva. So normal foreign body, I'll try very hard not to get into any problems with makeup artists. But bear in mind that when you do makeup on your eye using the mascara, the eyeliners, the lash liners, you can inadvertently introduce some foreign body or debris onto the eye surface. And you can see this black speck down here, likely from just a foreign body. In females commonly, it could just be some makeup debris that has landed on the eye, irritating the eye surface and making the eye red. And you can also have foreign body. So when you turn the eyelid outward, you see this black speck over here, illustrating the fact that foreign body on the eye can also make the eye red. Commonly too, you can also have people who do not use protective eyewear, especially when they are riding their motorbikes or their bicycles, and you have some wind blowing dust or debris into the eye. It can cause foreign bodies to become lodged on the surface of the eye, and that can also make the eye red. Then there can be goats on the eye. Goats, one of these is this small goat over here. It can also irritate the eye surface, making the eye red. Then there's this large lesion here. We call this a pterygium. A pterygium is common. It's common in our parts just because of our excessive exposure to sunlight and UV radiation. So when you have a pterygium, many people are walking around with pterygiums. It's a large, triangular, fleshy growth on the eye surface, very superficial. You look at somebody's eye like, what is that growing on your eye surface? When there is inflammation or periods of rubbing, it can also cause that lesion to become red. And we don't like forgetting tumors. Conjunctival tumors, as illustrated here, can make the eye red. But the difference between a pterygium and a conjunctival tumor is that typically when you see the tumors, you would find a feeder vessel, like a large vessel, which is moving directly towards whatever swelling or lesion or growth is on the eye surface. That should make you worried and think about the fact that no, this is not likely to be just a pterygium, just maybe it is a conjunctival tumor. Then the cornea. You can have redness at the level of the cornea. Any problem at the level of the cornea is described as a keratitis. So keratitis can occur and give you dry eye. So you can have people with dry eye syndrome. You can have keratitis from infections. You can have it from people who use contact lenses. So improper contact lens care or use can make the eye red because the contact lens is a thin, transparent material which is introduced onto the eye surface. That material inadvertently can pick up infection or debris can get lodged on it and can result in redness. Foreign objects in the eye, just like you can have on the conjunctiva, can also lodge on the cornea and give you red eye. Eye injuries, example, mistakenly scratching your eye surface can also give you a red eye. And then workplace-related injuries, very common. So chemical burns at work. So chemical splash in the eye when you are not wearing protective eyewear could be acids or alkali. People will come in with red eye and then they will tell you, oh, I had something splash in my eye at work, or unfortunately something just dislodged at work and splashed a chemical into the eye. Workplace-related injuries are common causes of red eye. Then we have the anterior chamber. Like I was saying about our science class. So anterior chamber, that's where we have aqueous humor. For those of you who remember some of your biology lectures, aqueous humor. So aqueous humor is what nourishes, it's also one of the things that nourishes the eye. So when you have inflammation at that level, we call it a uveitis. And that can also give you a red eye. You can also have hyphema. Hyphema in the middle photograph, that's when you have blood building up in the anterior chamber. Common causes of blood in the anterior chamber is trauma. Trauma, getting in a fight, getting hit by a blow. Those are the things that will cause blood to lodge in the anterior chamber with red eye. Then there are the glaucomatous causes. Bear in mind, glaucoma typically doesn't cause pain or redness, but there's one form of glaucoma that can do that. It's called the angle closure glaucomas. So somebody will come to the clinic, red eye, but the difference with this red eye is that they are in pain. They are in pain, a lot of pain. Sometimes they may even complain about nausea or the feeling of wanting to vomit. Some actually do vomit. When you examine them and look at them, realize that their pressure in the eye is really high. The anterior chamber is shallow. That form of red eye is from angle closure glaucoma. Then the sclera. We have what we call scleritis, episcleritis. These typically are associated with medical conditions, rheumatoid arthritis, lupus. Those commonly have these lesions on the sclera, redness in the region of the sclera. And you should bear that also in mind. So the orbits, when we say orbits, the orbit is the container or the holder of the eye. This is the structure that holds the eyeball in place. When you have any inflammation in the orbit, you can have a red eye. So this here shows redness. You can see that the whole conjunctiva looks very red and chymose, very bulbous. And then the eye looks like it's really tense. This is what we will call orbital cellulitis. So it's inflammation at the level of the holding structure of the eye. And patients like this will have red eye. The other photograph is what we would call a preseptal cellulitis. Preseptal cellulitis is very common in children, typically after they get a runny nose. So a child has runny nose, fever, these viral upper respiratory tract infections, and suddenly the mothers will complain that, oh, they wake up in the morning and the eye is swollen, it's red, they have a bit of difficulty opening the eye, they may have a temperature. Think about preseptal cellulitis as the likely cause of the red eye. Okay, and other causes, like I said earlier, medications, some of the eye drops we use on the eye can make the eye red. And then trauma, commonly in a fight, boxing ring. So you see somebody in a boxing ring, and then after that, you see that the eye looks really swollen and red. Likely they've bled into the eye. That is what we would call a subconjunctival hemorrhage, which I discussed earlier. So it can also make the eye red. So what next? Your eye is red. You consider all these layers of the eye, all the way from the front of the eye to the back of the eye. And you decide what is making my eye red. So the main thing is to determine the type of red eye you have. And then when that is done and you are seen in a health facility, the aim is to determine whether the redness is acute or chronic. Acute being that, well, the redness has been there for less than 7 days, and chronic means beyond 7 days. And then laterality, whether it involves one eye or both eyes. And then the pattern of distribution of the redness. And then associated symptoms. So once you have a red eye and you end up in a hospital, these are some of the things that need to be determined, okay? So like I said, acute versus chronic. When we say acute, what do we mean? Under 7 days. Common causes are the acute conjunctivitis. So we can have the infections causing it, so the bacterial conjunctivitis, the viral, the chlamydia, and then the non-infectious ones, which means that it is not caused by bacteria or viruses. So the allergens and the toxins, dust, and then the allergic tendencies that people tend to have, irritants, those are the things that can give you acute red eye. Wake up suddenly, the eye is red under 7 days. Acute conjunctivitis does that. Then subconjunctival hemorrhage from trauma or non-traumatic, a spontaneous bleeding into the eye. It can also give you redness. Angle closure glaucoma, acute redness, sudden onset under 7 days, redness, acute angle closure glaucoma does that. Iritis and scleritis can't do that. Then the chronic ones, that means long-standing, the person will have red eye, it will go, it will come back, it will come back. Commonly is the chronic allergic conjunctivitis. Typically starts in childhood. They have a lot of irritation of the eye. There are some people, they are persistently rubbing their eye. You know, those are the allergic conjunctivitis. Then they have a mucoid discharge. And some people, you look at them and they'll tell you, I mean, my eye is never white. It's always brownish. You know, those are the people with the conjunctivitis. So they have a brownish discoloration of the eye. And then when the doctor looks at the eye, there's something we would see and call it papillae. I'll show a photograph of that in a subsequent slide. And then when they have the very severe forms, some people since childhood, severe eye irritation, brownish pigmentation of the eye, and not settling with any treatment, those people tend to have a severer form, which we call a VKC, or the vernal form. Then a pterygium, like I spoke about, that fleshy growth on the eye, gives you chronic, long-standing. Today the eye is red, tomorrow it's not red. A week later, it becomes red again. Pterygiums do that. Blepharitis also do that. So, by way of clinical evaluation, typically this evaluation is done in hospital. Just so that whenever I see a red eye and you get to the hospital, you know that these are the things that the doctor in question or the healthcare provider in question is looking out for. So is there an itch or not? Typically, itching occurs in people with allergic conjunctivitis. Is there redness? All forms of conjunctivitis will have redness. Then is there a discharge? The discharge, the color of the discharge, like I said. So the yellowish, thick discharge occurs in the bacterial conjunctivitis. Clear watery discharge in viral conjunctivitis. The mucopurulent ones, like a lot, copious, smelly, you think chlamydia conjunctivitis. Then there's clear but stringy, like they'll tell you, I'm pulling something out of my eye. Those are the allergic conjunctivitis. Then whether there's a lot of tearing from the eye. So typically when the eyes are red, okay, there's a lot of discomfort on the eye. So people will have a lot of tearing, or we call it epiphora, or water, a lot of water flowing from the eye surface. Okay, and tapped across all the forms of conjunctivitis, but it is more in the viral conjunctivitis. Okay, and then we have follicles, papillae, membrane formation. These are the things when you get to a hospital with a red eye, beyond the fact that you have described the fact that your eye is red, the aim of the health provider is to determine which of the forms of conjunctivitis you have. And these are some of the things we look out for. Okay, and this further illustrates that. Okay, and then whether it's one eye or both eyes, we need to know. And then the patterns of the redness, whether the redness is diffuse over the whole eye surface, whether it is only at a small section of the eye, that is what we call sectoral, or whether it's really localized to a small lesion with a feeder vessel supplying it, then you start thinking about the conjunctival tumors. Okay, so the associated symptoms are key. Is there pain? If there is pain with redness, nausea, vomiting, we are thinking about acute angle closure glaucoma. Is there irritation? A lot of irritation occurs in viral conjunctivitis and keratitis. Then is there a gritty sensation? People will report to you that, no, when I'm there, I feel like there's sand on my eye. I feel like there's sand on my eye. We start thinking about, is there a foreign body lodged on the eye, or is the eye drying up? Okay, and when there's associated loss of vision, we are thinking more of angle closure glaucoma. And then when there's trauma, together with a large bleed on the eye, like I said, we are thinking about subconjunctival hemorrhage. Then we would evaluate you. So we'll take a history, ask you all these questions. Is there pain? Have you lost your vision? Is there irritation of the eye surface? Do you feel like there's sand on your eye? Is the light intensity to the eye too much? Or do you see rings around objects? All those are to help decide which form of redness you have. Because like I said, even lack of sleep can make your eye red. So we really have to be sure what is making your eye red. Then we would examine the parts of the eye, right from the eyelid to the back of the eye. So at the eyelid, sometimes we'll see these large nodules, okay? These are called follicles or papillae. When there are follicles, it's typically from the viral conjunctivitis. And then when there are papillae, it is from the bacterial conjunctivitis. And then the doctor may examine areas in front of your ears and then areas under your jaw. Those areas, we are looking at what we call lymph nodes or lymphadenopathy. Associated swellings in those areas likely results from the conjunctival tumors. And then the kinds of discharge we have, which we've discussed previously. Okay, then the cornea. We look at the cornea, whether it's clear, whether there's a patch on it, whether there's some swelling, whether there's a defect, whether there's anything on the corneal surface, even as small as a foreign body on that surface can make the eye red. Then the anterior chamber. Commonly, when there is pain with redness and we are looking into the anterior chamber, that area where there is aqueous humor, okay? The concern has to do with angle closure glaucoma, okay? So you are looking there to see whether the anterior chamber is of normal thickness or it's shallow. And then, or whether there's any collection there, blood in the anterior chamber. Those are some of the considerations when you're evaluating a patient with red eye. And this photograph here, and once again, is trying to categorize all the patterns of redness into what is expected in each form of redness, okay? And then I'll continue to the treatment. Treatment of red eye depends on the cause. Like I've said, red eye can result from anything at all. that one, irritates the ocular surface, two, infections or inflammation on the eye, three, foreign bodies, four, allergic tendencies, five, trauma. So there's a wide array of modalities available when you want to treat red eye. It depends on the cause of the red eye. So we can do topical eye drops. So there are antibiotic eye drops and antiviral eye drops. If we think it is a bacterial infection, we'll give you antibiotic eye drops. If it is viral, we'll give you antiviral. Then we give you the anti-allergic eye drops when we start thinking of the allergic conjunctivitis. Then systemic antibiotics come into play when it is the orbit or the holding or the structure that holds the eye in place, the orbit. That's when you're thinking about orbital cellulitis. We give you systemic antibiotics, okay? And the decision to treat is determined after clinical evaluation. And this clinical evaluation starts from the patient. And we go through the evaluation history, like we've been through, examination of the patient, like we've been through, and then a decision on the diagnosis is made. It is only after this that treatment for red eye is commenced. So in summary, anybody can get a red eye. Red eye can be acute or chronic. It is important to determine the cause of the red eye before commencement of any form of treatment. Thank you very much.
Thank you very much, Dr. Akofa Lassie. That was authoritative, that was clear, that was straight to the point, that was very, very, very informative. In fact, it's always good to listen to experts. When you hear experts, they talk confidently and they let you understand more and more. Now, most of you back in JSS, SHS, parts of the eye, you label and all that, most of you may not know there is more to it. Yes. So that is where she is an expert with anything related to the eye. Thank you very much, Dr. Lassie, for such in-depth explanation. But before, now it's time for questions and answers. If you have any questions, please put in a chat box in the comment section on YouTube, and I will read it out for Dr. Lassie to help us with the answers. But I have some few inquiries, if I put it that way. Now, can you hit back on how makeup artists, even though I know you don't want to have any issue with them, but we need to know for our own education, how makeup artists can cause red eye. Please go a little inside for us to understand.
Dr. Sedo here, you want to put me in a tight corner this evening?
They are not listening. They are not listening. Don't worry. We are the ones listening.
Okay. So one of the causes of red eye is foreign bodies. Okay. So beauty can be expensive. Let me start by saying that beauty can be expensive. So there's a price to pay for everything. So normally people do their makeup, they put on their eyeliner, they do their mascara, and they get away with it. Even lately, it's even more common to fix lashes onto the eye, and you can get away with it. But sometimes, inadvertently, people introduce some of these substances onto the eye surface. It's not intentional, but we've had patients who've come in and in an attempt to fix an artificial eyelash, they actually glue their lashes together, one, or they introduce the glue onto the eye surface itself, and they come in with a lot of redness and discomfort. So like I'm saying, there's a price to pay for beauty. Most people do it and get away, but some people get caught in the web. So I think you should be a bit more particular in an attempt to put on your mascara, your eyeliner, your lashes. Yes, that is basically what we advocate for. Dr. Sedo here.
Thank you very much. I like the way you are being professional, so you don't have any problem. Thank you. All she's trying to say is some makeup aggressive ones and those ones, non-professionals, can result in troubles. Even some professionals can. That's what she's trying to say. And again, pterygium is quite common in our part of the world. Can you please educate us a little more about it and show us a picture, please? Pterygium. you look into people's eyes, you see a lot of people have pterygium. And when you mentioned the conjunctival tumor, it's something we have to know about. Yes, thank you.
Okay, so if you look at this down right photograph here, so this is the eye. There's this fleshy growth from nasally, okay, from this point, let me know it's too much, this point onto the corneal surface. This black portion here is what we call the cornea, okay? The dark portion we see in the photograph, that's the cornea. So this growth from here onto the corneal surface is a pterygium. It is very common in our parts. In our parts, I mean places in the tropics because of sunlight. Typically results from UV exposure, okay? So in our parts, there's a lot of sunlight, beautiful sunlight, but the challenge with it is that we get exposed to a lot of UV radiation. So that causes a change in the conjunctiva, leading to this growth. It is very common. A lot of people live normally with pterygiums without problems, but when the eye starts getting red, that is the danger sign. It is at that point that sometimes they need intervention surgically for the removal of the pterygium so that the eye surface can be comfortable. Other times, when the pterygium becomes too large, it can affect vision. So sometimes you have a small growth. Once you have a small growth, you are fine. But when the growth becomes large and covers the corneal surface, it can affect your vision and make your vision blurry, or some people will have the vision not being so clear. There are ways you can protect yourself from developing a pterygium. They are not absolute though, but you can wear UV protective sunglasses. So the fact that you are wearing dark glasses does not mean you are having UV protection. So it's better you buy glasses with a tag that states that UV protection. Those are the sunglasses that protect you from developing a pterygium. So black is not protective. UV protective glasses are protective. And then, did you ask something about the conjunctival tumor?
Yes.
Okay. So conjunctival tumors too, they look like pterygiums when they are very small. But the difference is that vessel. There's usually this large vessel that supplies it. It's a big vessel. So that is what typically gives it away, okay? And they tend to be a bit more aggressive. I mean, they grow a bit more quickly. People can have pterygiums for years and they'll be fine. But once you have something on your eye surface, within a short time, it's growing very quickly. I think you need to get your eyes checked and examined to be sure it's not a conjunctival tumor.
All right. Thank you very much. Thank you very much, Dr. Akofa Lassie, for such a thorough presentation. Now, if anybody has any question, almost all my questions were answered during the presentation. I don't know about you, but if you have any question, please feel free, drop it in the comment section right away, and she will gladly answer you. Yes, please, any questions, drop it in the comment section, and she will gladly answer you. Yes, so there's something you also mentioned about the fact that you're working a dark glass doesn't mean you are protected from the UV light. Can you hit that side? Because all of us generally assume once you're in shade, dark shades, you are protected from the UV light. Can you please hit on that side again?
Hello, can you hear me? Hello, can you hear me? Hello, can you hear me? Please, can I be heard? Dr. Sedo here. So your question on the dark glasses. So Like I said, black is not protective. When you are buying sunshades, it's advisable you get the ones that specifically state UV protection. So there are shades and there are shades, let me put it like that. So yes, Fanciful is black, but when you are buying sunshades, some sunshades, you find a tag on it that states that UV protection, or sometimes they will say UV 100, UV 400. It is stated on the tag. So yes, we may all be wearing sunshades, but some people are actually wearing UV protective sunshades. Black is not protective. UV protective glasses are protective.
All right, that's clear. So we are hearing directly from the expert herself. The fact that you're in dark shade does not mean necessarily you are protected from the UV rays. And because of the UV rays and other issues, that's why we are predisposed more to having pterygium. And of course, if you have pterygium, okay, at the end, we'll talk about that one. Any questions? Anybody have any questions? Please feel free, drop in the comment section, in the chat box, and Dr. Akofa Lassie will help us. I'm trying to make sure I'm after Akofa Lassie because I'm used to Dr. Akofa Jomadu, you know. Yes. All right, thank you very much. Anyone has any question, please feel free. My question, most of them were answered thoroughly throughout the presentation. It was very authoritative, informative, and everything that we all need to know about red eye. And as usual, once you come to this channel and you do as well like this, we are forced to likely call you back again to come and share more with us in the future. So we are like Oliver Twist. We are already putting in application for possible return leg. Dr. Akofa, I hope our application will be kindly considered. Any questions? Any questions? Any questions, please? Anybody has any questions? Everybody just saying good things about Dr. Akofa. Somebody saying watching live from Asia, I'm happy about the presentation. Somebody say good presentation. All right, any questions for Dr. Akofa? We have a few minutes more to go. Do you have any questions for Dr. Akofa? I really enjoyed everything about the bits about the dark shades, the pterygium, the makeup artist, and the riders, bicycle riders, motor riders without protection, eye protection, and industrial workers without protection, high risk for having red eye. Let me just put it simply like that. All right, thank you very much. Anyone else has any question? Any question? Any question? We have 60 seconds to go. Okay, somebody is asking, can artificial tears reduce the irritation on the eye?
Yes, the answer is yes. So, yes.
So your answer is yes, if you have artificial tears, it can reduce the irritation on the eye. Any other question? Anyone else has any other question to ask while she's here? This is like free free consultation, free eye specialist consultation. If I were you, I would shoot all my questions. That's what I quickly threw my questions her way quickly and got clarified. I want you to have the same. We have 30 seconds more to go. I want you to do the same. Yes, I want you to do the same. Ask any question you might have so that she can help us answer it before she leaves. Okay, somebody has a question. The person says, I had my pupil dilated for an exam, but after that one, my eye has become blurred. Was that a reaction to the med I used?
Okay, so pupil dilation is very normal when we try to do an eye exam. So I need to clarify a few things from him. How long ago was this pupil dilation done? So sometimes it depends on the medication that was used to dilate the pupil. Some stay a few hours, some stay longer, some can stay a day, up to a day. So if this dilation he's talking about was done just yesterday, his vision may still be blurred. But if it was done long ago, then that is bothersome and the eye has to be looked at again because it is not normal for pupil dilation to persist beyond a week or two. So that's not normal. The eye has to be looked at again.
All right. So, Mr. Lawrence, if your eye, you still feel blurry, you still have blurry eyes, please, blurry vision, please kindly report back to the hospital, see a specialist, and you will be attended to. There's a question, doctor, I learned recently that our windscreens even expire. What advice do you have for drivers? Please, I want to know, do our windscreens expire?
Well, I'm not a car manufacturer, so I cannot speak on authority to that. You know, I think I'll leave that to those who are into car manufacturing. But
Okay.
I can state that it's safer to wear protective sunglasses when driving, because the kind of exposure you get when you are driving can be intense. Because you keep your eyes open longer just because you want to focus on the road. And then you have a lot of sunlight during the day when driving. So yes, if the windscreens do expire, well, I would find out that and let you know.
I will also have to find out that windscreen expired. It means my own have expired.
Then your car,
yes, so
get a new car.
Oh, I'm sure it expired. I'm sure it expired. All right, thank you very much. I hope, Reverend Doe, I hope your question has been answered. Any more questions from any one of us? From YouTube, Zoom, any of us, please put your questions in. It's been a very educative session. I enjoyed it. I learned a lot. And it's more, I learned a lot. I had a refresher plus additional knowledge, all that. I'm glad all of you who made time, you joined us, you enjoyed it. And those of us who joined us a little late, don't worry, the recording will be made available. I will make the recording available few minutes after we are done. The recording will be made available to all of us. Feel free, it will be made available. All right, so thank you very much, every one of you. Okay, yes, so I have a question, go ahead. Okay. What's the question, please? Okay, well, how long can one change glasses after you visit the eye doctor? How long?
Okay, so children, typically in children are a very rapidly growing age group. So we don't have a blanket time over which we ask that they change their glasses. Okay, so children, and typically children misplace their glasses often, they get scratches on the surface. So children, we can do it as frequently as possible. But in adults, typically we assume that the eye has finished growing and the structures are in places where they are supposed to be. So we say 2 years. 2 years is an ideal time to have your glasses changed.
All right. So for adults, doctor is advising that 2 years, you need to have your eyes checked and your glasses changed, possibly. That's the advice. 2-year intervals. I know some people wear it for 3 to 5 years. So the advice is 2 years for adults, but children, they're rapidly growing. So it has to maybe a little earlier. Am I right, Dr. Alassi?
Yes. Yes.
Okay. All right. So for children, maybe a little earlier. All right. Okay, she's asking again, any special reasons for the 2-year duration?
Okay, so it's the lens powers. You know, the lenses that we are using making the glasses. So they lose power with time. And the clarity. So like I said, mainly the clarity you get with the lenses you use, it diminishes with time. From handling of the glasses, all those things reduce the quality of the images you can get. So we say that within a 2-year period, that is enough time for the lenses to lose their value and you would need a new one.
All right, thank you very much. We are still learning a lot. We're still learning. I'm still going to find out if car windscreens expire. All right, that's a new information right there. Any more questions? 30 seconds more so that we can go. So that I can, she's a very busy woman, very, very busy. I'm actually honored that she's accepted our invitation. But of course, as Oliver Tuesday, we're going to ask her to come back at another time to give us more about other topics related to the eye. If anybody has any last questions to ask, please, this is the time to do so now. YouTube, Zoom, we are watching so that I can just quickly read it out to her. All right. Can pterygium be removed totally in Ghana?
Oh, yes. Oh, yes. A big yes.
I like the answer. I like the, oh, yes. Yes, we have the means of removing it totally. Then my follow-up question will be, can it recur?
Yes, it can recur.
Wow. Okay. The surgery, is it a simple surgery or it's an extensive surgery? And the person is wanting to ask, are there side effects?
Okay. So, well, surgery is surgery. I don't want to belittle any surgical procedure that has to be carried out. Yes. But it is a day's procedure. So if a pterygium surgery has to be done, you come in that day or that morning. We take you to theater. We numb the eye with some drugs, remove the pterygium, you go home that same day. You come back the next morning, we take off the iPad, and voila, you are back to where we started from. The only thing is we'll keep you on some eye drops because sometimes it gets a bit uncomfortable when the pterygium is removed. So yes, it's a very straightforward procedure. I don't want to say simple because surgery is surgery. It's a very straightforward procedure. Yes. Basically, that is it.
All right. Thank you very much. Thank you very much. Thank you very much. That has been great. So now, yes, I think at this point, now, Dr. Akofa, I want you to give us again your last takeaway messages about red eye. But before then, most of us, I am a corporate. If my boys have red eye or I know somebody with a red eye, we just enter the pharmacy shop and buy the nearest, the most available eye drops. What do you have to say to that? I'm sure there are people on this call who are also corporate in that area.
It's a no-no. That is why I took my time to go through all the things that can cause a red eye. Some people work based on the assumption that once my eye is red, it's really nothing. I only need a drop or two and it will clear. But that is why I attempted to show that it is not that simple. There are several things that could be accounting for the redness, and those things need to be determined. And it is advisable that it is only after that determination is made that you put drops on your eye. Just like the way you would go and see a physician when your blood pressure is up or when your blood sugar is not controlled. I think it is prudent that when your eye is red and you can, just get someone with expertise to look at your eye before you start putting drops on it.
Thank you very much. There's the last question in the comment in the YouTube. I don't want to leave it out. And it's a very important question because of our current state of doing things. What eye care would you recommend to those of us, I'm adding myself, who use computers daily, our phones? What eye care would you advise?
Okay, that's a big question. So the current dispensation or regime we are in, there's a lot of screen exposure. So now everybody is using their phones, people are using their computers, people are continuously watching television. Like the extent of eye use, I think, is much more than centuries ago. So one, we advise that whenever you are doing screen work, you take breaks in between. So we have what we call the 20-20-20 rule, where when you sit behind your computer for 20 minutes, you take a break, look at an object or whatever it is about 20 feet away and blink 20 times. Okay? Because when you are using your computer, you reduce your blink rate. You reduce your blink rate. That is the problem. That is where the problem starts from, because you reduce, it's not magic. You just reduce your blink rate because once you are looking at your computer, you are attempting to do a lot within a certain period. So you reduce your blink rate, and reducing the blink rate causes the eye surface to become dry. So it is prudent that if you think your screen exposure is too much, one, start with the 20-20-20 rule. That is one. Two, we can give you protective glasses. So we have this blue cut glasses or the anti-reflective glasses that are in the system. If you think that will be more, if you think your screen exposure is too excessive, we can give you that. Blue cut glasses, anti-reflective coating glasses to help reduce the radiation exposure. 3, we can give you eye drops to help ensure adequate lubrication of the eye at every point in time. So what you've described, that's what we call the computer vision syndrome, okay? So yes, those are the 3 ways of attempting to reduce dryness from the screen exposure.
This question came last, but I think it's one of the best questions so far. I think all of us need to learn about this 2020 thing. At least I just tried doing it, 2020. So if you can go by the 2020, that's the easiest to do for all of us. Can you go by it for us again?
Okay, so when you work at your screen for 20 minutes, you stop, look at an object a distance of 20 feet, blink 20 times. People modify it in different ways. So when you do screen time 20 minutes, you can stop, take 20 steps, blink 20 times, but the aim is to blink. The aim is to blink.
Yes, here I am. I've been blinking. I think I've blinked 28 times now. All right, thank you very much for knowledge, for information. We appreciate you, Doctor. Yes, so your final words. Okay, somebody's asking, is there any effect on screen time in the dark? Yes. Is there any effects of screen time, excess screen time in the dark? Those of us who watch Netflix from 11 p.m. to 2 a.m.
Okay, so screen time in the dark, the main challenge with it is what we call astinopia or eye strain. Okay, so once you are working in the dark, you are sitting in a dark room but watching on a lighted screen. Okay, your eye has to work more, the power of accommodation. So there's something we call the accommodation convergence reflex. I don't want to do too much biology, but unfortunately so. So that reflex comes into play, okay? So you are in a dark room on a lighted screen. So you have what we call eye strain. So after doing all that, you can wake up with headaches, a lot of discomfort on your eye, blurry vision, because sometimes after doing all that, you sleep inadvertently, not closing your eye. You get lag of light. Yes, so those are some of the challenges with that method. So eye strain, headache, dryness, those are the things that can happen with watching screens in the dark.
So this means you don't advise us watching movies in the dark room. You prefer we put the light on?
Yes, preferable.
How about cinemas, big cinemas, you know?
So yes, big cinemas, they do it, but you are watching that movie I don't know if you go to the cinema every minute or every day, but you're watching that one movie once a month. But if you are sitting at home and every day exposing your eye to this persistent accommodation convergence, then you would have symptoms of astinopia.
All right. Somebody is asking, an eye specialist told her vision 360. What does it mean? She's asking.
Oh, vision of 360 means that you see 360. So you see at 3 meters what a normal person or a person considered with normal vision will see at 60 meters. That means that's not good vision. That's very poor vision.
Oh, yeah. Okay, so the 6.6 is the best, right?
Yes, 6.6 is the best.
Whoa, so 6.6 means you see at
6 meters. A person with normal vision sees at 6 meters.
I think today, Charlie, you've covered everything in eye. Charlie, Dr. Akrofa, we appreciate you. Thank you very much. We've gone beyond the red eye thing. We are now doing a lot of other things. Thank you very much. I had an amazing audience, and it's time to let you go back. Give us your final words, please.
So the final slide, anybody can get a red eye. Red eye can be acute or chronic, but there has to be a determination of the cause of the redness before commencement of treatment.
All right, thank you very much. Okay, so there was a last question. What glasses would be advisable for those of us who use laptop a lot? I think she answered that earlier. It has to be prescribed for you. Is that what you said, Dr. Akrofa?
Yes.
Okay. So for those of us who use laptop a lot, you want to protect your eye, go see your doctor. the specific glasses that you need will be prescribed for you. Now, in summary, what I learned is that not all red eye is the same. So if you have a red eye, redness of the eye, you and I don't have the expertise to know fully what the underlying cause could be. It could be a red herring, just a tip of the iceberg. So we all need to go to the hospital. That's the essence of this weekly program, to give you expert knowledge so that when you think you have a problem, you seek help. We may not prescribe drugs here, but we ask that once you suspect yourself or someone close to you has an issue, please seek medical knowledge. Don't go praying about it only or wishing it away only or hoping it. No, just seek immediate medical help, and there is help available for. Once again, please, all of us, join me, say a big thank you to Dr. Akofa Lassie. She went in deep, very confident, informative, elaborate, thorough, and I learned a lot. We all learned a lot. And just by doing that, doing us well, treating us well, we will be inviting Dr. Akofa Lassie again, but we want to be sure. Dr. Akofa Lassie, please, when we throw the invite, will you accept?
This is public ambush.
All right. Thank you very much. I know you love us, so you will come again. Thank you very much, every one of you. Those of us who join us late, I noticed some few people join us late. Please, I'm dropping again I put the YouTube channel link in a chat box on Zoom. Please go there, subscribe, put a notifications button on so that anytime we come on live, you get notified. And there are a lot of other videos that were done in the previous weeks that you can benefit from. If you have any questions, you can drop the question in the chat box and I'll gladly answer you with the help of the expert. Thank you very much once again, Dr. Akofa Lassie, for an amazing presentation. We enjoyed everything and we will put to use, to practice all that you have taught us today. We appreciate you. And for the rest of you, thank you very much for making your time to join us, gain this knowledge. Feel free, recommend it to your friends to also go watch the video when I upload it in some few minutes so that we can have more people having accurate medical knowledge on medical topics. Thank you very much. Until I come your way once again, it's been a plum pleasing pleasure serving you all. Let's all enjoy our morning, afternoon, evening, based on when